updates for UK citizens. Number of cases. As of the 4th of March, a total of 16,659 people have been tested in the UK, of which 16,574 were confirmed negative. 85 were confirmed as positive. The Department of Health and Social Care will be publishing updated data on this page every day at 2 p.m. until further notice. This data is accurate as of 9 a.m. on the day of publication. If more cases are confirmed in the UK, it will be announced by the Chief Medical Officer of the affected country. Returning travellers. Stay indoors and avoid contact with other people immediately if you've travelled to the UK from Hubei province in China in the last 14 days, even if you do not have symptoms. Iran, lockdown areas in northern Italy or special care zones in South Korea since 19 February, even if you do not have symptoms. Other parts of mainland China or South Korea, Hong Kong, Japan, Macau, Malaysia, Singapore, Taiwan or Thailand in the last 14 days and have a cough, high temperature or shortness of breath, even if your symptoms are mild. Other parts of northern Italy, anywhere north of Pisa, Florence and Rimini, Cambodia, Laos, Myanmar or Vietnam since 19 February and have a cough, high temperature or shortness of breath, even if your symptoms are mild. Do not go to a GP surgery, pharmacy or hospital. In Scotland, call your GP or NHS 24 on 111 out of hours. In Wales, call 111, if available in your area, or 0845 46 47. In Northern Ireland, call 111. If you get a cough, a high temperature, or you feel short of breath, continue to follow this advice. Do not leave your house without getting advice from a doctor. Please follow this advice even if your symptoms are mild. This guidance is based on the recommendations of the UK Chief Medical Officers. These areas have been identified because of the volume of air travel from affected areas, understanding of other travel routes and a number of reported cases. This list will be kept under review. What this means in practice. This means staying at home for 14 days after arriving from Wuhan or Hubei province, or other parts of China if you have symptoms, and not going to work, school or public areas. Try to avoid having visitors to your home, but it's okay for friends, family or delivery drivers to drop off food. While the risk to the UK population remains low, these steps are recommended to limit the potential spread of infection. Transport. Do not use public transport or taxis until 14 days after your return from Wuhan or Hubei province, or other parts of China if you have symptoms. Getting food and medicine. Stay at home for 14 days after arriving from Wuhan or Hubei province, or other parts of China if you have symptoms, and avoid public places. Ask a friend, family member or delivery services to carry out errands on your behalf. Taking children to school. Stay at home for 14 days after arriving from Wuhan or Hubei province, or other parts of China if you have symptoms, and avoid public places. Ask a friend or family member to take your children to school. If your children are well and have not been in Wuhan or Hubei province, there is no need for them to stay off school. What is the risk of catching coronavirus in the UK? The UK Chief Medical Officers have raised the risk to the public from low to moderate. But the risk to individuals remains low. Health professionals are working to contact anyone who has been in close contact with people who have coronavirus. Recent government action. The government published its Coronavirus Action Plan on the 3rd of March. On the 10th of February, the Secretary of State for Health and Social Care, Matt Hancock, announced strengthened legal powers to protect public health. The Health Protection, Coronavirus, Regulations 2020 have been put in place to reduce the risk of further human-to-human transmission in this country by keeping individuals in isolation where public health professionals believe there is a reasonable risk an individual may have the virus. Diagnosis and analysis. The UK is one of the first countries outside China to have a prototype-specific laboratory test for this new disease. Healthcare professionals who are contacted by a patient with symptoms following travel to an affected area have been advised to submit samples to Public Health England, (PHE), for testing. Individuals should be treated in isolation. After the experience of the severe acute respiratory syndrome, SARS, in 2003, PHE developed a series of diagnostic tests to detect any member of the family of coronaviruses. These have been used for several years and were able to detect the first UK case of the Middle East Respiratory Syndrome, MERS, in 2012. With the first reported publication of the genome sequence of a 2019 novel coronavirus, PHE was able to rapidly develop further specific tests for this virus, working with WHO and a global network of laboratories. When a clinician suspects novel coronavirus, COVID-19, they take samples from the nose, throat and deeper respiratory samples, package and send them safely to PHE Colindale. PHE can provide a laboratory result from this specific virus on the same working day. PHE also has the capability to sequence the viral genome and compare this to published sequences from China, if a case occurs. This will provide valuable information on any mutations in the virus over time and allow an improved understanding of how it spreads.